Radiographic findings of infection are always not obvious as well. They sometimes present with humeral osteolysis, component loosening, periosteal reactions, and endosteal scalloping. This is a really nice study by Serena evaluating the causes of humeral loosening. They found the majority of stems with humeral loosening were aseptic. Females in isolated humeral stem loosening was often aseptic as well, and combined humeral and glandular component loosening was usually septic. Preoperative diagnosis and workup is also challenging. ESR and CRP have poor sensitivities for diagnosis of shoulder PHI with mild elevation, and sensitivities can be below 50% for shoulder infections, which, for hip and knees can be 90 or 80%. And the data isn't much more clear for aspirations. This was a nice prospective concordance study that showed a positive preoperative intraarticular synovial fluid sample correlated with intraoperative tissue cultures at the time of arthrotomy confirming an infection. They found an 80% concordance rate, and the use of preoperative antibiotics increased discordance. Other studies found discordance rates as high as 44%, and increased concordance was associated with gram-negative organisms and MSSA. So what about cell count thresholds? Well, a lot of different values out there in the literature, but a threshold of about 2,800 can be recommended to predict PJI, but 50% of attempted aspirations are dry taps, which makes things challenging. What about joint fluid analysis and cytokine peptides? Well, alpha-defensin is an antimicrobial peptide that represents the innate immune system. Its role is to directly neutralize invading pathogens. Decent sensitivity and specificity has a strong association with frozen sections of acute inflammation. This isn't anywhere our hip and knee literature, which comes closer to about 100% sensitivity and specificity. What about leukocyte esterase? Well, it's an enzyme that's predictive of infections in the hip and knee literature. It is released by neutrophils in response to pathogens, and leukocyte esterase is less predictive than alpha-defensin. Again, both are significantly less than the total hip and total knee literature.